pop everyone on mute, just so that you can all hear me. If you do want to speak, feel free to just towards the end when we've got questions and use the chat bar. So just to remind everyone, this is being recorded at the moment. So thank you. It's Friday the 10th of July. Thank you for joining me this morning. I'm going to start by giving you some updates, and I wanted to talk to you about the NHS England letter that came out yesterday. So I just wanted to give you a heads up that Moorfields Eye Hospital have reopened the site at Potters Bar Community Hospital, and they'll be running medical retina injection clinics for the existing patients only. And new urgent referrals are still being seen at City Road or Northwood Park after triage, and so they're sort of phasing in the restart at Potters Bar, which is great news. The next thing I wanted to just remind everyone is about if they look after a care home and that care home were to have a COVID outbreak, just to make sure that you've spoken to your care home. That's just so they know the protocol, which is available on Public Health England website. But effectively, they've got to inform the health protection team as soon as any case is identified, even if there's just one, and then they will ask Public Health to come in and do a risk assessment and determine what the next steps are. And normally, if it's 2 or more cases, they declare that as an outbreak or an outbreak suspected, and then order a batch of tests, which are rapid tests for the whole of the care home, which includes residents and staff, any member of staff that's been in there, bank staff or who visited patients, etc. And they get the results very quickly. And then they retest everyone again every 28 days, and that's always available. The next thing I wanted to give you a heads up on was about InHealth. I've had lots of questions about this and about whether sites have reopened up, etc. So I can tell you that Golders Green has just started to reopen up. But of course, as we know, InHealth have other sites, including Barnet and the North London Diagnostic Centre, etc. These are just being discussed today, actually, at North Central London. So we should have an update on those in my Tuesday webinar as to what's happening with those sites. I'll keep you posted next week about InHealth. I've also had a lot of questions this week about whether we can access ECG, and all the borough leads at the CCG have been flagging this in North Central London so that we do get quicker access to ECG. I know it's been a bit of a pain recently for colleagues. We've been sending people to ambulatory care, we've been sending people to InHealth, all sorts of things, and it's really not great for us and our patients. So we are working on that to get that sorted out as soon as possible. The next thing I wanted to tell you about was a shielding update that was announced middle of the week, and that really was to remind colleagues that if you've got patients asking you questions and in the shielding group, what does that mean for them? Well, it means that from Monday, they're still strongly advised to stay at home as much as possible and keep interactions outside to a minimum. But they no longer need to socially distance from people that they live with, and certainly they can meet up in a group of 6. But this is outdoors, and this is really absolutely clear. It's not an indoor meeting, it's an outdoor meeting, and that's what we call the support bubble, with one household meeting with other support bubbles. So they could be single adults or households. So that's just to be absolutely clear. And then the final thing that is about children really on that list, they should still not return to school or nursery before the 31st of July if they're in the shielding group. And if parents or carers are shielding, it is advised that their child only attends educational care, childcare settings if social distancing can be adhered to. And that's really clear on that. And then just to remind everyone that from the 1st of August, provided there are no significant increases in the numbers of COVID-19 cases, shielding advice will be paused, and the government will reconfirm this and publish this nearer the time. The next thing I wanted to update you, I know that there was a CMC webinar yesterday, and there was a lot of questions about end-of-life drugs. So I just wanted to give you a heads up that what we've done is looked at what pharmacies in the borough will always stock end-of-life care drugs. It always happens on a Friday afternoon where we've got a palliative care patient and you need to get drugs in for the weekend. This is available on the Barnet intranet, but I'll just give you a heads up of where they are. Boots in Edgware, that's the Broadwalk Centre, will stock it. Oakley Pharmacy in Whetstone will stock it. Fairview Pharmacy at Finchley Memorial Hospital. Tesco's in North Finchley. Woman Free in Golders Green, and Care Chemist in Mill Hill. They are the pharmacies that have signed up to always stock end-of-life care medications. So if you are stuck, then do have a look on the intranet, but also I've just referenced them there. Right, so the most important part of today's update is about the letter that you may have received from NHS England or NHS E&I about the next arrangements for primary care and the rest of 2020-21. And I just want to go through what the main headlines are. And the main headlines are that there's continued suspension of appraisals and revalidations until further notice. QOF is recommenced from the 1st of July. And interestingly, they've asked us to focus on flus. So do we have a flu plan in place? And I know that the CCG has written to PCN directors this week to ask colleagues and practices to see whether we've got any ideas of how we think flus could be delivered at either practice level, PCN level or borough level, to see if there's any support that CCG can give us. What I've been told to date, and obviously this could change, is currently there's no additional funding available from NHS England. Obviously, this is being looked at the moment and is a national directive, so it won't be something local if funding is available. And they're also asking us to look at prescribing and really screening. And so they're saying that we should be focusing on cervical screening and other types of screening in primary care, and then looking at the new sort of cancer indicators and the learning disability DES if we've got patients under that. So NHS England have asked us to focus on those. And as you know, in previous correspondence, we've been told that we can do learning disability work virtually, so we don't have to see the patient face to face for the annual health check, and we can do that virtually, so something we should restart. And they've provided income protection for those indicators, and so that's really great to hear. We've also been told in the letter that we should return to providing, if we're not already doing, new patient reviews, routine medical reviews, over 75 health checks, clinical reviews of frailty, and vaccinations for shingles. Now, again, apart from the vaccination, of course, we can do the majority of these things virtually through telephone and video. It's not suggesting that we need to be bringing these patients in face to face, but it's when we phone up and say, actually, we're only dealing with urgent things, we should be saying, actually, we're routinely doing frailty reviews, the over 75s, etc. And they've still asked us to maintain the 1 per 500 population appointments for CCAS. So this is the 111 slots as well. They've also told us that we don't have to submit friends and family results at the moment. And then they're going to review the PCN stuff, which is due to start on the 1st of October, and give us more comms nearer the time. I know that NCL are also reviewing LCSs centrally, and I was in a discussion yesterday about that. There is an NCL LCS working group that's set up, and we've got 2 of our commissioning managers from Barnet that sit on that group, Nick Ince and Anthony Davies, who will be contributing to that. And at the moment, I know that we're working on LCSs to be launched in the very coming up and future. I've got 2 other very small updates for you. And one is just to remind people that are colleagues that are bringing in babies or children or infants for vaccinations. The guidance still says that, what we're saying is that parents should be advised that the vaccines may cause a mild fever, which usually resolves in 48 hours. And as we probably all know, it's days 6 to 11 following an MMR, which is the commonest thing. But they don't need to isolate unless COVID-19 is suspected in that time. The next thing I want to just give you a heads up is about audiology. Our community provider, Audiological Science, have contacted all patients on the waiting list and triaged everyone, and they've continued to see urgent patients during the pandemic. They've had telephone consultations with those and provided management plans for earwax. And as you know, earwax removal remains a very high-risk procedure and is currently suspended. The provider has the facility to remotely program hearing aids, which is a really great improvement in technology. And then allow patients to collect or get posted batteries or consumables for their hearing aids. And they've also got drop-offs available for people's homes if they're vulnerable and shielding. The provider is very ready to start up given the NCL sign-off, so we're just waiting for NCL to give them the green light and they can get going and restart. And again, a very similar thing with MSK, which I'll update you on next week. I'm just waiting for some sort of final things with MSK, and I can give you the heads up about that. And before I stop, I just want to remind colleagues that I mentioned a couple of weeks ago, there's a fantastic course running next Thursday, the Royal London Paediatric GP Update course, which is being done virtually. And if you just Google Royal London Paediatric GP Update, you'll find it. It will cover things like IBD, GORD, constipation, UTI, wheeze, chronic cough, allergy, headaches, fits, and all that kind of thing. And it is a paid for course, so I think it's about £120. So I think it's a really great course. Sorry, it's next Wednesday. Thank you, Jenny. Yeah, absolutely right. It's next Wednesday. I think it's a really good course. for colleagues to sign up to. So I'm going to pause there for any questions or anything that's come up in the chat bar. If anyone's got any questions, feel free to come off mute and ask me now. Tao, you've got your hand up.
Thanks, Nick. So regarding the one-on-one slots, I think that the NCL position is still to maintain it at 1 to 3,000 rather than 1 to 500 that maybe officially NHS England is asking us.
Correct. So you're right, but contractually NHS England are setting the rules and asking us that we can actually flex down to 1 in 500. So I know it will go to NCL. It's tricky, isn't it? Because yeah, you're absolutely right. There's no, if you look at the usage of the slots, I've looked at them over the last few weeks, we're not using anywhere near that. And the COVID pandemic peak has calmed down. And certainly we're probably not even using the 1 in 500 at the moment.
But at least I guess we have a bit of reassurance that we can stick to the 1 to 3,000 and say that this is the official line that NCL guided us.
Yeah, that's absolutely reasonable. And I've got colleagues from asking about podiatry and MSK, not yet at the moment, but I'm in discussions with them next week, and I'm hoping for them to restart the week after is the plan. And so that will be across the NCL wide sector for MSK and podiatry, and I'll keep you updated in next week's webinar with confirmation of that. Are there any other questions from colleagues at all? If there are, just use the chat bar. I can pick up them later on and speak to you about them on Tuesday or reply on the chat bar. Okay, everyone, have a fantastic weekend, and I'll see you all on Tuesday. Take care. Bye,
Thank
everyone.
you, Nick. Have a nice weekend.
You too.